It's very difficult to explain to somebody who hasn't had a cluster headache the extent of the pain. Like somebody in my head grabbing my optic nerve and twisting it. And at its very worst, I was getting 10 a day, each lasting 50 minutes, and being untreated. In terms of medical treatment, it was very seldom that medication would win, in that the headaches would still get worse after that. At that point, I would have been admitted to hospital, and I would be given intravenous steroids over a 4 or 5 day period. The impact at home and on my social life, it was terribly isolating. You would have to avoid people in the house to save them witnessing you suffering. I avoided social events for fear of getting a headache. I avoided physical activity. I avoided sports. I avoided cycling. I avoided going to the gym because of getting headaches, but also because of the fear of getting a headache. I almost wish they didn't use the word headache to label this condition, because it simplifies it into everyday language and people associate it with a traditional headache. They went up in through my inner mouth and up that way and placed it in behind my cheekbone, just here. The swelling was gone within a day or so. The stitches had dissolved within 2 weeks, and I went back 3 weeks later for an assessment of the wound, and they said it was all clear, which then gave the all clear for the remote control to be switched on and the device to be connected. I place it on my cheekbone, which is directly opposite where the implant is, and I adjust the power until I start to feel a tingle. And I feel the tingle here, I feel the tingle here, and sometimes I feel the tingle down there. The Pulsante system stopped about 50% of my headaches initially after the device was switched on, which was a big improvement on the use of drugs effectively. At the same time, I'm continuing to use the device for long-term treatment. So the number of headaches I'm getting is starting to reduce, and the severity of those headaches is starting to reduce. I think my headaches stopped in a 10-day period and have not returned. So I decided to do a little test, and I stopped using the remote. And when I stopped using the remote, my headaches came back. I restarted using the remote, and the headaches went away. And to be sure, I repeated that exercise and the same thing happened. So I have gone from a full dose, having been on melatonin, Topamax, lithium, verapamil, triptans, nasal spray, triptans injections, and oxygen. 4 months ago, I am now on half a dose of verapamil. Over the years, experiencing all these headaches, for some reason, thankfully, I was able to remain optimistic that I would control them, or they would get better, or I would be cured. And I always hung on to that hope. With this device, it's not just hope, it's becoming a fact. It's becoming real, that I can, at worst, control them to a manageable level where I can carry on with my life. At best, control them to the point where I don't notice they're in my life. Over the period of this new treatment, somebody in Ireland won 39 million on the lottery. This is my 39 million.